Kumar. My age is 54 years. Okay.
Ask the patient to bring the hands in front of them and look for any peripheral sinuses, and turn over and look for any xanthomata, ulcers, nose, and look for the temperature. Could you bring 2 fingernails like this for me? Check for the capillary refill time. Venous pulse provides the information related to the dynamic of the right side of the heart. Pressure and the waveform. Internal jugular venous pressure degree of distension is a direct reflection of the pressure of the right atrium, and the waveform. Jugular vein to examine either internal or external. Internal jugular vein is preferred over external jugular because direct continuation of the right atrium hence reflect more accurately the dynamics of the right heart. Look for any pulsation in the neck, whether it is jugular venous pulsation or carotid arterial pulsations. Patient in sitting position, chin slightly elevated and rotated to the left. Look for any pulsation in the neck between the two heads of the sternocleidomastoid muscle or in upper part of the neck medial. Patient lie comfortable with the trunk inclined to the 45-degree to the bed at the waist with the chin slightly elevated and rotated to the left. Decrease the angle of inclination below 45-degree to a level where a visible pulsation can be seen above the. For any pulsations in the neck, if it is yes, then look whether it is jugular venous pulsations or carotid arterial pulsation. Examining the carotid pulse with the index and the middle finger. Jugular venous pulsation is superficial and lies along the sternocleidomastoid muscle. Carotid pulsation is more medial in the neck and it lies in the border of the larynx and trachea. Jugular venous pulsation is undulating, having multiple peaks and tuft, whereas carotid pulsation has single upstroke. Difference between the jugular venous pulsation and carotid pulsation. Inspection. Look for the color and texture of the skin, any suture marks, any dilated engorged superficial veins, and inspect the pericardium. Pericardium is a region of the thorax immediately in front of over the heart. The chest. Normally here it is bilaterally symmetrical. Compare both sides of the chest and both sides of the chest movements. Then check for any local rise of temperature and tenderness. Locate the apex beat, parasternal heave and thrill. Temperature, you have to find out any local rise of temperature, because if there is any local rise of temperature, then there is suspicious cancer tumorous growth inside the chest cavity. Next, look for the tenderness. Tenderness means pain on touch. Border of your hand over the prominent point. After that you have to mark the apex beat, that is the most prominent part of the heartbeat, with the tip of your index finger. Identify the second intercostal space and the borders of the heart. Identify the second intercostal space. Put the tip of your finger at the jugular notch and try to move downwards till you find a ridge. If you find a ridge, try to move your fingers over the right and left. That is how you find the second intercostal space. Start percussing from the second intercostal space on the right side. You will find in normal cases a resonant note. If you are finding dull note, it means it is an upper boundary of the lever is present. Normally over the lungs, there are 5 cardiac areas: mitral, tricuspid, aortic, and pulmonary areas. Specifically valve locations: aortic, pulmonic, Ebbs point, tricuspid, and mitral valve. Aortic found right of the sternal border in the second intercostal space represent S2 dub, which is the loudest. And next is the pulmonic found left of the sternal border in the second intercostal space represent S2 dub, which is the loudest. The third is the Erb's point found left of the sternal border in the third intercostal space. No valve here, just the half-away point. Next, the tricuspid found left of the sternal border in the fourth intercostal space represent S1 lub. Mitral found mid-clavicular in the fifth intercostal space represent S1 lub. Then listen with the bell of the stethoscope at the same locations for blowing or swooshing noise, that is heart murmur. Heart sounds. First sound and second sound. First sound S1 is due to the closure of atrioventricular valves, and S2 is due to the closure of semilunar valves, aortic valve, and pulmonary valve. Third sound S3 is due to rushing of blood into the ventricles, and it is a low pitched sound. Fourth sound, it is due to the contraction of atrial musculature, and it is an inaudible sound, and it is inaudible due to the vibration of ventricular valve during atrial contraction.